I have special interest in performing joint replacement surgeries through minimally invasive approaches and with the use of technology.
Stay tuned. Dr. Mudit Khanna gives us a closer look at his robotic equipment and shares real clips of it in action during a patient's knee surgery.
Today, I'm very excited to share with you our MAKO robotic system, which is the robot that we use to perform robotic joint replacement surgeries. So let me walk you over through what a robotic joint replacement surgery really entails. We can perform a robotic surgery not just for the knee, we can perform it also for the hip, even for the spine. There are a number of applications of robotics in orthopedic surgery. Essentially, the robot is composed of three components. What is there on your left right out there is the robotic arm. This is the arm with which we will be executing the particular surgery. But where does this arm get its information from? So we've got a main guidance module here. This is where all the surgery is planned, where we try to exactly match the components to the patient's native anatomy and then try to reproduce that anatomy on that patient. Here is a camera that you can see, and this is the screen that is visible to us as a surgeon because the patient is lying on the bed there as we perform the surgery. The patient has a set of arrays that communicate with the camera and give dynamic or real-time information about what is happening to the knee to the guidance module, where all that information is fed. We then use that information to modify our preoperative plan and to execute it to perfection on the patient for that particular patient. The precision offered by the robotic system is up to 0.5 millimeters, definitely less than a millimeter. This has never been possible before, and therefore I am very excited about this particular technology, and I'm very positive that we'll get wonderful results in the time to come. So we are all getting ready. The patient is ready. We're scrubbing up, taking the necessary aseptic precautions, and all set to start the case. So here we are, all set up for a robotic total knee replacement surgery. The patient is draped up and prepared for the procedure. What you can see here is the MAKO robot, which is standing on our left here. And if you move on to the side screen here, we've got the camera that will communicate to the arrays that we will put. Can I see the arrays? The arrays that we will be attaching to the patient's tibia and to the patient's femur, and these arrays will then communicate with the camera and relay live information to the brain or the console, and that will help us plan the procedure better. So we mapped the femur and the tibia and we compared it to the findings of the CT scan. We had about a 0.3 mm difference between what the CT recorded and what we recorded on the femur, and about 0.2 millimeters difference between what the CT recorded and what we recorded on the tibia. So which means an accuracy of less than 0.5 millimeters, half a centimeter. The software was able to tell us that the patient had about 3 degrees of deformity in the knee before she developed arthritis. And our objective now was to give her back the same anatomy, the same 2.5 degrees that she had before developing arthritis. We were very effectively able to reproduce the same anatomy that she had prior to surgery, and we hope she's going to have an excellent recovery.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.